Good afternoon. My name is J.Harton. I am here with BD's Educational Director, Ms. Danyelle Thomas. I am here conducting a interprofessional interview and leadership and management reflection in regards to my PUB 660 Leadership and Management in Public Health course instructed by Dr. Dixon, and I am here to ask Ms. Thomas a few questions. Ms. Thomas, you can go ahead and introduce yourself and we'll jump right into the interview.
Hi, I'm Danyelle Thomas. As stated, I am the director at BD Early Learning Center, and we're here to do an interview.
Thank you for that introduction, Ms. Thomas. So, just to give a little background on what we're going to be discussing today, we are here to talk about the Flint water crisis and the impacts it had on the community and the public in general. So I'm just going to ask you just a few questions just about how you feel about the Flint water crisis and what you think could have been done better and how it could have been prevented, and also just a little information on what leadership and management skills you could have helped navigate through the situation. So I would start the interview off by asking a simple question of what were the primary public health concerns associated with the Flint water crisis, and how did they impact the community?
Well, back in 2014, Flint had the idea of using their own water source, so that they wanted to get rid of the Detroit Water and Sewer Department. So in doing this, they didn't properly treat the water, and this led to lead contamination, which exposed thousands of residents, the children, and high levels lead poisoning, which was affecting their developmental delays, impacting their long-term cognitive impair, and also causing neurology damage. With the outbreak, we got legionary disease, numerous people in the hospital, numerous deaths, and this only affected the low-income families, which were majority minorities in the community. Total disjustice or injustice for the health community.
Thank you for that, Ms. Thomas. Another question that I would like to follow up with: how can perspectives and strengths from both the public health sector and another sector, such as engineering, policymaking, or social work, be integrated to address this crisis?
When it comes to the policies and the policymakers and the environmental engineers and things, we have the engineers. They were the environmental engineers were the water infrastructure, and they needed to meet the standards that to improve the water treatment, and they needed to change the lead pipe they needed to do a lead pipe replacement program. That was one. The policymakers needed to advocate and be stronger in their funding to prevent the crisis and to ensure the accountability and the trust of the public.
Okay.
Public health experts assessed that it was a long-term health impact of the lead exposure and developmental interventions, which they needed to do screening programs and community health education.
And let me ask you, what pivotal piece would you say the social workers provided in this crisis?
Social workers, they were pivotal as far as helping the families with their mental health, providing the resources, addressing how this psychosocial impact was on the families. It was a major crisis. It needed to integrate these perspectives, and the comprehensive solution can be developed to prevent and mitigate responses to future environmental health disasters again. So we needed their help a lot. We needed their input, and the families needed to be able to be comfortable with them.
Thank you for that information, Ms. Thomas. That was a very detailed answer, and I do appreciate the insight that you did provide on that such topic. Moving on with the interview, I would like to ask you another question of what leadership and management principles can be applied to effectively address and prevent similar public health crises.
Main thing is transparency and accountability. The government and the health officials need to provide clear, accurate information to the public and take responsibilities for these failures. The crisis team and the rapid response need to develop an emergency response plan and conduct risk assessments that can detect and mitigate problems before it escalates to this. The interdisciplinary collaborations, they need to be more effective leadership that cooperate with the public health officials, the engineers, the policymakers, and advocated groups to implement sustainable solutions. Effective based decision making, the policies and the intervention should be based on scientific research and public health data to ensure effectiveness and prevent misinformation.
Thank you for that information, Ms. Thomas. As we seem to unwind and get, a little bit more information on what the crisis actually unfolded within the city of Flint, another question that I would say would be, one of the things that helped with the challenges that were brought upon the citizens of Flint, which is, what are the biggest challenges in applying leadership and management principles to the Flint water crisis?
It was a lot of government mistrust. It was years and years of neglect and misinformation from officials that led to the community distrust, making it difficult to implement public health solutions effectively. Resource allocation. Flint lack of financial and technical resources to address this crisis effectively highlighted systematic disparity in the public health funding. Long-term health effects. Addressing the lead exposure requires decades of monitoring, medical care, and educational support, and in affected children requiring substantial leadership and investment.
Thank you for that information, Ms. Thomas. As we get to our last question of the interview, I would just like to thank you for your time and thank you for carving out a piece of your schedule to actually sit down and speak with me and then talk about this sensitive but still difficult topic that is still occurring to this day. So I would just like to finish out the interview by just asking this simple question: what solutions can be proposed to ensure that a crisis like Flint never happens again? What do you think about that?
We need stronger water safety regulations, enforcing strict corrosion control measures, lead testing, and infrastructure maintenance at a federal and local level. We need warning systems, rapid response teams to intervene before the public is exposed. You have to get in there and replace the pipes. So we need a replacement of lead pipes. We need to modernize the water treatment with sustainable funding from the state and federal. We need community education and engagement that will be accessible information for water safety training. Families need to be able to know what they're dealing with and be able to be advocates for themselves in order to help prevent this from happening again. If they don't know and if we don't teach them, they won't be able to survive if this ever happens again, praying that it never does.
Thank you for that information, Ms. Thomas. We do appreciate you. This now conducts our interview.